What ended up happening kind of from a more clinical perspective with you is you are being treated. So there's basically 6 canals total. So if you think about the inner ear balance organ, if you think about back to elementary school biology, right, where they showed you that snail looking thing, right, and said, okay, this is how you hear and all this stuff. Okay. But they don't often go into the how the inner ear helps us balance, right? They might mention it, but they don't talk about it a whole lot. So if you think of a snail, and in the body of the snail are those calcium carbonate crystals. So we all have rocks in our head. My wife tells me I have rocks in my head all the time, right? And those rocks are supposed to be in the body of that snail. And what vertigo is when those rocks get into a place where they're not supposed to be. So also connected to the body of the snail are basically 3 tubes. And vertigo happens when those rocks get into the tubes, and they're not supposed to be there. The tubes serve a purpose, but they're not supposed to have rocks in them. And that's when people get vertigo. So then the rocks get in the tubes, and it sends an unnatural signal to our brain. And then usually it's the spinning sensation, and that's a true vertigo symptom, the rotational spinning. But people can also get, vague dizziness, lightheadedness, just general unsteadiness. Even their thought process and their cognition can change. All these kind of random symptoms. I call it the elephant in the room that nobody can see, right? And so on top of all this, so not only do those rocks get into those tubes, there's 3 tubes on each side of our bodies because there's an inner ear balance organ in each ear. So there's basically 2 snail-looking things in our head, one on one side, one on the other side. And so there's 6 canals that people can get vertigo in. And as a result, it makes it even more complicated to treat. In your case, you had vertigo in 3 canals, which is not uncommon. We see it often. It's not the most common, but it happens. We see it. And actually and it actually took one treatment session to even bring out one of the canals. So we had to get your crystals stirred up a little bit to get things going to even find out that there was a 3rd canal involved. So all to say that it is complicated and it can be difficult to figure out. So specialists in this needs mentoring. They need constant study, and they need lots of experience to be able to see this and lots of different. To work with a number of different people in order to be consistently successful. And that's one of the challenges in our healthcare system is the number of consistent specialists who are mentored and then trained and see vertigo and other inner ear balance problems 1,000 times, 1,000 which ways.